Dr. Theresa Oey-Trudeau is a general surgeon who performs colon cancer screenings in Brookings. She says the most common type of screening is a colonoscopy.
The reason is because it is very sensitive and very specific for finding polyps as well as cancers. Polyps we're able to remove, so it can also be therapeutic as well as diagnostic.
Other types of screenings include the FIT test, which uses antibodies to find blood in a person's stool, and Cologuard, which screens a person's stool for colon cancer and precancers. Many of these tests depend on the comfort level of the patient.
Not all people want to do a colonoscopy. It does involve a prep, and so it does put some people off, and so they've come up with some different options for people if they're truly against doing a colonoscopy.
Dr. Oey-Trudeau says the FIT test and Cologuard are great because there is no prepping, but if they show up as positive for colon cancer detection, it ends up going to a colonoscopy.
So it has more benefits to it. It has been shown to be more sensitive, but the drawback is that you have to have a colon prep beforehand.
Prepping your colon is one of the biggest parts of a colon cancer screening, and the Miralax prep is a common preparation tactic that has undergone some changes.
A few years ago, it was you take the whole bottle of Miralax and 64 ounces of fluid at one time in about 2 hours. Now, there's the other option of doing half of it at one time and then half of it about 4 or 5 hours right before the colonoscopy.
Dr. Oey-Trudeau also encourages eating foods with low fiber before a screening.
We also recommend a low fiber diet for it prior to the colonoscopy because those are the things that aren't digested, fiber. And so if you have a low fiber diet beforehand, even if it doesn't get cleared out, it should be to the point where we're able to suction it up when we're trying to look at things.
But don't worry, they do knock the patients out for colonoscopies with anesthetics like propofol.
Another option is propofol, which is very quick on and off and is titrated by anesthesia in real time as we're doing the procedure. And so people do really, really well with that one.